Okay, hello. We are live here from Tecnomed Hall in Cologne, and we are about to start to present you the Falko project, Falko Connect. So we will wait 1 minute for the people to be online, and we will start the presentation of this innovation in tele-dentistry. And you will see that it is the helmet that I have in my hand. And the peculiarity of this helmet is that it can be connected to various video connection other devices that can help you in a cooperation mode or in giving you the possibility to see and watch inside the visor a lot of valuable information for the patient. For example, the medical history of the patient. You can see the radiograph, and even other outsource can be attached to it. For example, an intraoral scanner. So it is very feasible to be put on. You can regulate inside the focus and the interpupillary distance so that any operator can operate inside that. And you can switch, as you see now, I have switched to another mode. Now the Falko is connected to two devices, one computer that have the information of the radiograph or orthopanoramic radiograph, and then it is attached to a microscope. In this case, you are able to see two video sources. And what is really nice and feasible that you can have a telecooperation mode, because let's say an example that you need a telecooperation mode and you can give this signal to an external computer that can be either in another country or in another office, and the expert can actually draw with a pen on the model, and you can follow the instruction of the expert. So we will do here an example. Okay, let's say that I'm an endodontic teacher. Okay, let's say that a student of mine has to perform its first apical surgery, and it has the Falko Connect with a microscope, and he wants to know what is the flap design, what he has to do. So the expert designed the flap design on the computer remotely, and I am able to follow the line while I work, and I can follow the design that he has made, and remotely I can know exactly what is the flap design, for example. This is just one of examples, but imagine your dental technician remotely can give you advice if you have to do some correction on the crown that you are trying directly on the patient, for example. Or if you need a consultant from an oral pathology, for example, in which can give you the advice, if you find some lesion, oral lesion, he can give you advice and draw, for example, the margin of the lesion that you need to operate to do the surgery. And in a lot of other modes, this helmet can be useful. It has an additional module that if it is turned on, I can have the control of the mouse. Now you will see the cursor that it is moving. Okay. Rosetta. Okay. So now I am directing and moving the mouse with my head, and I can change the mode with some pedal. And I can switch to an external camera or another source. There is also another option that gives the possibility to the operator to dictate by voice some note that you want to put on the patient info on the note. Okay, so there is also this option. You push a button, you start talking, and the software automatically have the caption of what you have said. So this can be really useful in case you need to do some notes and you don't need anymore to write it by hand. Now I'm going back to the other switching mode, and I can operate and have the possibility to work also in an erect position, because there is not any delay. It's instant and it's pretty easy. Imagine to have an intraoral scanner and doing the scan procedure, and you don't have any more to turn around to see the screen. And this can be useful in many manners. Okay, so depending on the outsource that you can have a different vision, or if you need a consultancy from another doctor, but it's not actually inside the office, you can have an international consultancy and direct one. Okay, and it's really feasible. It's not that difficult to work in such a way. So it's not something that is just shown, but it's actually pretty much easy to move the hand. You can move the outsource in other places, and you can also switch to a different mode selection. Puoi selezionare. Esatto. You can choose also different way of visualizing the image. You can put it side by side, for example. Okay, in this way, so you have from the right the patient info, and on the left you have the video source and what you are seeing. And another interesting feature, if somebody of you know me, I teach endodontics, and I have this system to do remote courses directly on patient. Okay, in which I can interact with the audience and I can do a live patient while I'm doing the endodontic procedure, for example. So this is really feasible, and especially the software has many functions that can help you to achieve, to have more quality for the patient. Okay, and like the microscope, in this way you can really work in an erect state. Okay, so you don't have to bend or to have an unhealthy position. So you see, I am directing the mouse with my head. And now I go back to the disposable. Okay. So as I told you, there is the possibility of teleoperating from outside, and there is the possibility to draw from an expert and outsource something that you may want to do. For example, we will do another example. Draw. Disegna di nuovo. Of course, you have to turn off the cursor. You give the control. You give the control to the person that is assisting you remotely, and he can help you and can indicate you what to do. For example, the design of a flap, and here I see the flap overlap the patient, so I can go and I can follow the line and the indication from an expert, for example. Then you can delete it. You can choose another color for saying or doing other things, for example. Or you can draw, for example, the margin of an incisor. Disegnami qua giù, guarda, fai tipo una linea così inventor. For example, you can have a consultation with your orthodontist that can tell you what space he needs is for any procedure, or your dental lab that give you directly the indication of the modification that you need to do in order to have enough space for the material or any other need directly and remotely. And you will be able to see it in the patient mouth, and you can discuss it in real time with your technician like he was in your office. So, and if you want to try, there are three stations here, and you will see exactly what I see, so you can have an idea of what the system look like and how easy it's to see and how clear is the view and how feasible it's to work also in a position like this. Okay, so if you have any question, you can come and try. Hey.
Keep it like this.
Yeah, okay. In India. Yeah, nice meeting you. I saw the wonderful work you have done in India.
For Tele-dentistry.
Yes.
And then later
I thought halal. Yes. Oh man, bring me to India. I never visited.
Sure. Next. Yeah, I now have a very simple this thing that let's work together. Let's do some conferences together. You call me to a conference, I call you to India, we will talk together. So we will have to do that way. So we go together faster. I'm sure I will call you.
Yeah. Let me know what company like are more feasible to make all the setup. You know, I don't work with Tele-Italiano, but also Talala doesn't work. But you know,
it's okay.
We are freelance.
For me, it's okay. I got that.
And you know, the system, it's really nice when you do endodont. Like I have this system in my office, and I transmit in direct live patient for a close number of people. So what I was thinking, it could be that for the first thing, I could not also have to come to India, but doing remotely with a real patient from my office. Like you could have 300 attendees while I have a patient, and I have an external camera like that, so I can interact directly with the audience.